For the first time in nearly 20 years, U.S. regulators approved a new treatment for the Alzheimer's disease. The decision is not without controversy, though. An advisory committee says there isn't enough evidence to show it works, and it will carry a hefty price tag, $56,000 a year. Tens of millions of people worldwide suffer from Alzheimer's, and there is no cure. Karina Huber reports from the state of Vermont.
For the first time in almost 2 decades, the U.S. FDA has approved a new treatment for Alzheimer's, a disease that affects more than 40 million people globally.
The Alzheimer's Association has been waiting decades for this. This is such an historic moment and a huge victory for people all over the world suffering with Alzheimer's and their families.
The drug is called aducanumab and marketed as ADUHELM. It is designed to clear amyloid protein from the brain, one of the defining features of Alzheimer's. For the past 3 years, Aldo Cereza has been a part of ADUHELM's UK clinical trials. He says he's seen an improvement.
I couldn't remember, where to find things in the kitchen. That has become less of a problem now. I'm beginning to find more things out for myself.
If effective, ADUHELM would be the first drug to stop progression of Alzheimer's, making it best suited to those with early onset of the disease. But results from the U.S. clinical trials were mixed. A panel of outside experts advised against approval, citing concerns about its efficacy.
The drug does what it is supposed to do biologically. That is, it reduces amyloid in the brain. It removes amyloid from the plaques in the brain. But the question is, does that have a clinically meaningful effect?
The FDA granted the drug accelerated approval, saying it seemed reasonably likely to benefit Alzheimer's patients. But Biogen, the company that made the drug, has to conduct a new clinical trial to prove its efficacy. It plans to have results by 2030. The FDA can later remove it from the market if it is not proven to be effective. People who want to use the drug, which is given intravenously on a monthly basis, will need to be monitored by MRI or other brain scanning technologies at a doctor's office or a healthcare facility. Potential side effects include brain swelling and bleeding. The drug comes with a hefty price tag, $56,000 for a year of treatment. But much of the cost will be covered by insurance or Medicare. Despite the numerous concerns about the drug, Alzheimer's advocates applaud the FDA's decision.
At the end of the day, what matters is that people with Alzheimer's will have access to this today so that they don't have to wait 3 to 5 more years for another trial. And by that point, they may not be eligible for it and may no longer be able to access those memories. That's the key.
Karina Huber, CGTN.
For more on Alzheimer's and this new treatment, ADUHELM, we spoke to Dr. Jeffrey Burns, the co-director of the Alzheimer's Disease Center at the University of Kansas.
And on some levels, it is a game changer, but the big question about how big of an effect does it have on patients remains to be determined in the next few years. The studies were tested in people with very mild or mild Alzheimer's disease, and so the data that suggests there's a clinical benefit and supports that idea that patients will do better on this drug was collected in people in those early stages. So big questions like, will patients in the moderate to severe stages benefit from this drug are unknown. There's probably many pathways to the dementia syndrome of Alzheimer's disease. And so understanding that process it's incomplete, and therefore our approaches to treating it are incomplete. So right now we're targeting amyloid, and we've been working on amyloid on targeting it therapeutically like this for a good 15, 20 years. But there's other things at play in Alzheimer's disease, and we need to go after those things as well.